is the head of the CDC. Is her job in jeopardy this morning because of the communication that we've seen?
Well, I can't really comment on her job in jeopardy with the administration. I do think that they really need to do more coordination across the government, across the administration. And the CDC leader has important roles to play in that, but isn't and shouldn't be the chief voice of the policy decision. She needs really to be the scientific surveillance, data-driven voice. And I think that as we all know, we've been living through an enormous surge with a very infectious virus. The guidance has changed. It needs to change, but the communications from the administration as a whole have been challenging.
This is critical because the United Kingdom has provided leadership by jettisoning as a general statement PCR. Are you suggesting in the coming hours, or may I say days, that you'll see the U.S. follow suit and jettison PCR certitude?
Well, that I don't know for sure that is going to happen. I think that there is some evidence that's emerging about some of the tests not picking up Omicron. And we have to remember that the way that Omicron was first really detected in South Africa was because of its variants on PCR testing there. It's just such a very variant virus. The early studies that are suggesting the rapid tests may not pick it up as efficiently are not yet peer reviewed, and they're relatively small, but that's something we're really paying close attention to because, of course, people are relying on rapid testing at home to make all kinds of decisions.
Dr. Beyrer, how close are we, from your estimations, of getting more rapid tests and making them available, since this does seem to be the key aspect, kind of locking the hands of the CDC to recommend that everybody get these before they emerge from isolation?
Yeah. We were concerned a couple of weeks ago that the increase in testing and the availability and the administration's plan to make them free and more widely available was not going to happen in time to deal with the holidays and the post-holiday curves that we're seeing, and unfortunately, that's exactly what's happened. So the estimate is roughly that by the 3rd or 4th week of January, we should be coming out of this testing shortage, but that again is not going to be in time to deal with the post-holiday waves of infection that we're seeing. So we're going to have about 2 weeks where people are still going to be frustrated we won't have enough tests.
Doctor,
and those 2 weeks are going to be critical.
Forgive me for jumping in, sir, because we only have a couple of minutes left. You've touched on, I think, the heart of the problem for a lot of people when they listen to the CDC. Am I listening to the science, or am I listening to some convoluted version of behavioral psychology? At the very start of this pandemic, we were told that masks weren't that useful because we didn't have that many masks. And now we're being told we don't need to test out of isolation. And lo and behold, we don't have many tests. And I'm trying to work out whether policy is shaped by scarce resources or science. Which one is it, Doctor? Is this policy dictated by scarce resources or science?
Well, I'm afraid you're quite right that it's a mixed picture, and that I think is part of the challenge with the communications. You want it to be driven by science, but there also has been a kind of try to balance, the administration has been trying to balance what the American people will tolerate. A great example of this is that Tom alluded earlier to our lower testing rates than other countries. That is really true. We're still only at about 62, 63% fully vaccinated. So what do we do about mandating, which many people would say the science supports, but the politics of mandating vaccines in this country are very challenging. And so that balance is what you expect an administration, a government to do. But what we want to see from the CDC, of course, is not that they are taking those political calculations, but rather that they are really looking at what is the best evidence and tracking that evidence as it changes and communicating that indeed there are going to be changes like we've seen with Omicron. It is way more infectious, probably twice as infectious as Delta, but it does appear to be producing less serious disease. The hospitals are jammed. We are back on emergency standing here in Maryland and in Baltimore, but the ICUs are not as crowded, and the people in intensive care are unvaccinated. That hasn't changed. That's still the science.